Hello and welcome to the WAFA Outcomes Dataset User Guide. Things we'll cover in this presentation include a background and introduction to the Outcomes dataset, required and optional outcome indicators, survey questions and scales, collection of survey responses, clinical indicator data collection, reporting, exemptions, review, and some questions. So to start off with the background. Now, as you will know, WAFA undertakes an outcomes mapping process for all service providers. The outcomes map currently includes co-designed indicators to assist service providers with continual improvement and also to report back their successes to WAFA. However, we are going to add some consistent set of indicators to this in order to allow for consistent measurement across all services. We also hope that you will find these indicators to be helpful for your own continuous improvement purposes. This presentation isn't about the outcomes mapping process generally, it's more about the actual indicators that are being added to this process. The required indicators have been chosen to align with the person and clinical domains of the WAFA Outcomes Framework. These outcomes and indicators will go into the outcomes map along with the additional indicators that are co-designed and chosen by your service to be helpful for you. Moving on to WAFA's required and optional outcomes indicators. There are 6 required outcome indicators. 5 of them will be the same for all commissioned services, and 1 of them will be dependent on the service type. There are 11 additional outcomes indicators which are optional that you can select to include if you would like. You may find these useful for your own business intelligence and continuous improvement processes. However, they are not required. Exemptions and substitutions can be applied for if you feel that any of the required indicators are impractical for you. Here we have the required outcomes dataset. Down the left-hand side is the quadruple aim, including the 4 outcome domains. In the middle is the required indicators, 3 within person and 5 within clinical. However, indicators 10, 11, and 12 do not apply to all services. They depend on the type of service that is being delivered. And on the far right are the optional outcome indicators that you might choose to report on if you would like. Now, moving on to the required indicators for the person domain. Services must report on all of these indicators. The first indicator is the percentage of clients, indicating that staff showed respect for how they were feeling. The second one is the percentage of clients that had opportunities to discuss their support or care needs with staff. And the third is the percentage of clients indicating that they had their culture, beliefs, and values respected. These will be collected using a survey. You may wish to pause to look at the wording and the scaling of the survey questions. Moving on to the optional person indicators. You may choose to include some of these if they align with your organization's objectives. So these include the percentage of clients that would recommend the service to family and friends, the percentage of clients that had access to the staff involved in their support or care when they needed it, the percentage of clients that were listened to in all aspects of their support or care, and the percentage of clients indicating that staff worked as a team in their support or care. These will also be collected using a survey. You may like to pause here to review the wording of the survey questions and the scales. Moving on to the clinical required indicators, which services must include. So the indicators here are the percentage of clients indicating that the care received will help them manage their condition better, and the percentage of clients who feel that their health will improve after receiving care. Again, the survey questions are provided below along with the scale. You may like to pause to have a look at this. Now, here we're moving on to the clinical indicators that are specific to different kinds of services. If you are operating a mental health service, your clinical indicator will be number 10, which simply corresponds to whatever you are already currently reporting as part of the primary mental health care minimum data set for the Commonwealth Government. You will already be collecting this, and therefore there is no change required. So your service will already be doing this, and we will just use this to further monitor your progress. Similarly, if you are operating an alcohol and other drug service, your clinical required indicator will be the KPIs that you are already reporting to the Mental Health Commission. So I'd like to reiterate there is no change of procedure here. The clinical indicator is already something that you're required to report to the Mental Health Commission. We only ask that you report this to WAFA as well, so there will be no change to your surveying of your clients. However, if you are operating a chronic disease program, there will be a new tool that you will be required to report to WAFA, which is called the EQ5D5L. So that will be a change for you and something new that you will need to incorporate into your practice. Moving on to optional clinical indicators, which you may choose to report on for your own improvement purposes. The optional clinical indicators include the percentage of clients who understand their condition and treatment, the percentage of clients indicating that their care is planned with people who work together to understand them and their carers, put them in control, coordinate and deliver services to achieve the best outcomes, the percentage of clients indicating effort was made to listen to the things that matter most to them about their health issues, the percentage of clients indicating effort was made to include what matters most to them in choosing what to do next, the percentage of clients feeling more able to make positive lifestyle choices, the percentage of clients whose condition has improved, measured by a validated tool or clinical guideline. You are at liberty to choose what you might like to report to WAFA, and the percentage of clients reporting improvement in circumstances. On this slide are the survey questions and scales that you would use to measure these if you choose to report on these. You may like to pause to review this slide. We will now move on to the collection of survey responses. All clients accessing services commissioned by WAFA need to complete a survey, including the required personal and clinical indicators. These surveys need to use the same wording and response scales provided. Clients are to be surveyed at 3 months from their first contact or at discharge, whichever comes first. The minimum response rate is 30%. This is the minimum number of responses required to make any sort of generalization about a service. Here are some options for incorporating WAFA's required survey questions into your data collection methodologies. If you already have a survey, you can add WAFA's required questions to your existing survey. However, we do still ask that you use WAFA's required timing, which is to survey clients at 3 months or discharge, whichever comes first. WAFA does require this for consistency. If your service does not have an existing survey for your patients or a method to collect feedback, WAFA will provide you with information and support on how to design the survey using SurveyMonkey. SurveyMonkey is free to sign up, and you can use the basic functionality if you have a survey that is less than 10 questions. Moving on to the clinical outcome indicator data collections. As specified before, if you are administering a mental health or an alcohol and other drug service, you will already be collecting these and already have this in place as part of your standard processes. If you are operating a chronic disease program, there will be a new data collection for you based on a tool called the EQ5D5L. For mental health, the indicator will be the outcome indicator for the primary mental health care minimum data set, which includes the K10, K5, or the Strengths and Difficulties questionnaire, whatever is suitable for your client population. For chronic disease, the required clinical indicator is the EQ5D5L. We require that this is collected at first contact and discharged, so that there is a matched pair of two surveys so that we can assess improvement in symptoms. Demographic items are also being collected for each client, including age, gender, and Aboriginal and Torres Strait Islander status. The EQ5D5L is an internationally standardized measure of health status. It has 5 dimensions, including mobility, self-care, usual activities, pain and discomfort, and anxiety and depression. It is designed for client self-completion. It's cognitively undemanding and takes only a few minutes to complete. Here you can see an example of the EQ5D5L. As you can see, within the 5 domains, there are 5 levels that correspond to having no problems, having slight problems, moderate, severe, or being unable to carry out activities of daily living. On the right, you will see there is a visual analog scale for patients to determine how they're feeling today in relation to their health. Patients choose a number from 0 to 100. WAFA has applied for registration on behalf of our Commission services to use this instrument. It can be administered on paper or a digital copy which is suitable for a tablet. To reduce the reporting burden, WAFA will use the Mental Health Commission's outcome measures to measure the outcomes of alcohol and other drug programs that are co-funded and already report to them. As you will know, SINS is a data collection tool developed by the Mental Health Commission. If your service is not jointly funded by the Mental Health Commission and you are not already reporting to SIMS, WAFA will provide you support on reporting to this. Here is an example of the kinds of questions that are included in this data set. Moving on to reporting. Your contract relationship manager will supply you with templates to add your data results. Counting rules will be provided to assist providers in understanding how their data is collected. The data plan will be required to be completed for each commission service along with an outcomes map. This is an example of what a template for reporting might look like. For the next iteration of outcomes maps, providers will be asked to submit a data plan for each commission service. Data plans lay out all the specifications for how data will be collected, including the method of collection, where data will be stored, and who is responsible. Here is an example of what a data plan might look like. Here is a flow chart of the process for completing a data plan and some questions that you might ask. For instance, if your service is already completing a survey and it is already being administered to clients at 3 months or discharge, you can simply add WAFA's required indicators to your existing survey. If those conditions are not met, WAFA will provide you with support to use SurveyMonkey to collect this information. Moving on to exemptions. WAFA will exempt a provider from required indicators if any of the following criteria apply. If the indicator is not relevant to the service, if it is not appropriate, if it is impractical to collect, or if the reporting burden is too great. Some services are already exempted from the required indicators. This includes general practitioner services, comprehensive primary care, healthcare home, headspace, and integrated team care services. These services are exempted from the required indicators only. They still will need to produce an outcomes map, which will be populated with co-designed indicators of their choice. Contract relationship managers can apply for exemptions on behalf of the provider. An exemption can be granted from the outcomes mapping procedure altogether, from some or all of the required indicators. A required indicator could be substituted with an optional indicator, or an indicator could be removed from the suite of indicators if it is not considered suitable and none of the optional indicators are suitable either. So the process for applying for exemptions is that the form will be completed by the contract relationship manager. The request will be submitted to the Outcomes Framework Steering Committee for a recommendation. This will then be considered by WAFA's Commissioning Coordination Committee, and feedback and decisions will be provided to the contract relationship manager, who will then inform the service provider. WAFA will be reviewing the Outcomes Framework on an annual basis, and we are interested in all feedback. Please send all of your comments or suggestions to your contract relationship manager, who will place these on a feedback register to be considered during our annual review. Moving on to frequently asked questions. You may have noticed that there are no required indicators for Outcome Maps domains 3, which is the healthcare system, and 4, which relates to the provider. For these outcomes domains, providers will continue to use co-designed indicators. Some providers ask if there is a suggested number of indicators. While there isn't a prescribed number of indicators for the co-design process, less is more. Ensure that the main areas of impact or outcomes the program is trying to achieve are captured, but prioritize these. Also, pick the best piece of evidence instead of having a handful that measure the same thing. Indicators should be relevant, achievable, timely, and realistic. Contract relationship managers should balance their desire to know a lot of information with the outcome of reporting on the most important things. Now, moving on to the primary mental health care minimum data set Commonwealth requirements. Reporting to the PMHC MDS, including the clinical outcome measurements, is a mandatory requirement directed by the Commonwealth Government, and unfortunately, WAFA has no discretion to exempt providers from reporting to this. For consistency, WAFA has chosen to use the outcome measurements from the PMHC MDS to inform our outcomes framework. As noted, WAFA cannot exempt providers from reporting to the PMHC MDS or completing the outcomes measures, unless the program is out of scope. The Commonwealth has stipulated that a lack of compliance with mandatory reporting by providers could lead to a conditional funding or even a loss of funding for WAFA and also for providers. The definition of the outcomes collection measurement is that at a minimum, collection of outcome data is required at both the episode start and the episode end, but may be more frequent if clinically indicated and agreed by the client. This means that there must be a matched pair of outcomes measurements. In most cases, this will be the K10. For Aboriginal and Torres Strait Islander clients, this will be the K5. And for children and young people, this could be the Strengths and Difficulties questionnaire. Again, a matched care of pre and post measurement is required for this by the Commonwealth Government. Provider organisations will be given a standardised dashboard and a data report of their first year's reporting and compliance with the PMHC MDS. Relationship contract managers will assist providers to complete a remediation plan to improve reporting rates. This will include barriers, enablers, and suggested strategies to assist. Thank you very much. We look forward to reporting on your outcomes indicators.